Good morning, students. Welcome back to Common Questions in Genetics. In today's class, we will be discussing about some of the prenatal diagnostic tests. The first one is amniocentesis. Amniocentesis is usually performed at 17 to 18 weeks. It is slightly more accurate than the chorionic villus sampling genetically, that is, it is 99.5% accurate. It allows less time for legal termination, that is, under 20 weeks of gestation. Laika rich in shed fetal cells is cultured, and late in pregnancy may even be tested for fetal lung maturity. So here we can see an image of the amniocentesis. So how it is done with the help of a ultrasound diagnostic test. A small syringe is inserted through the abdomen into the uterus, and the amniotic fluid is collected through the syringe. And then it will be sent for the laboratory testing to check for any genetic abnormality. The findings of the amniocentesis. Elevated levels of AFP and acetylcholinesterase may include the neural tube defects such as the spina bifida or anencephaly, or may be due to other developmental or chromosomal problems. Chromosome studies which require growing the cells for cells for 2 to 4 weeks in a culture medium may reveal structural changes, missing or extra chromosomes. Amniocentesis is performed only when a risk for genetic defects is suspected, because there is about 0.5% to 1% chance of miscarriage after the procedure. Next, we see about the Cordocentesis. This involves percutaneous ultrasound guided cord blood sampling for assessment of fetal blood disorders, RH, isoimmunization, hemolysis, fetal infections, and urgent chromosomal karyotyping. RH negative mothers are given anti-D for all invasive procedures. What is the procedure? The procedure entails passing a spinal needle through the mater abdomen and uterine wall into the umbilical blood vessels under high resolution ultrasound guidance. A blood sample is aspirated into a heparinized syringe. Remember, it is an heparinized syringe to avoid the clotting of the blood. The preferred site is the placental cord. Fetal abdominal cord and free loops of the cord are also acceptable. So here we see the image of the cordocentesis, where with the help of an ultrasound guidance, a syringe is inserted through the mother's abdomen into the uterus, and it reaches to the umbilical cord, from which the fetal blood cells are collected into an heparinized syringe. Sometimes the sample can be collected, as said earlier, from the other cords or loops as well. What are the complications of cordocentesis? It includes placental abruption, chorioamniocentesis, premature rupture of the membranes, premature labor, cord hematoma, that is the blood clot of the cord, and fetal distress, where it can occur because of lack of oxygenation going through the blood supply, and transient fetal bradycardia. Again, the heart rate of the fetus might decrease. So it is a quite risky procedure. Next procedure is the fetal tissue sampling. Fetal tissue sampling is indicated for disorders that are not diagnosable through the amniocentesis or the CVS. Fetal skin, liver, or muscle tissue may be sampled at 16 to 12 weeks gestation. The skin specimens about 2 mm in diameter, typically are taken from the buttocks, back, thorax, and occasionally the scalp. Remember the sites. It can be taken from the buttocks, back, thorax, and occasionally the scalp. The procedure, fetal tissue sampling, is performed under the guidance of ultrasound with the client mildly sedated in order to decrease the fetal movement. So here is an image of the fetal tissue sampling. Through the ultrasound guidance, a small sample of the fetal tissue is collected from the back of the baby. The risks are miscarriage, amniotic fluid leakage, maternal or fetal infection or injury, premature delivery, hemorrhage due to the injuries, and cosmetic or functional injuries. So this is about the various prenatal diagnostic tests that we have seen, that is amniocentesis, cordocentesis, and fetal tissue sampling. Hope you understood, students. Thank you.